Used to hear criticism over its response to the virus. Last night, the president declared that Vice President Mike Pence would take charge of the coronavirus task force. Tonight, Trump was back in front of the cameras himself.
We have a situation with the virus. We've done a great job. The press won't give us credit for it. I think it's an incredible achievement that our country's done. We're giving whatever other countries need. We're helping them. But we have to run our country, too. A lot of people say, why isn't he in China? Well, China has to want that. And other places have. But they're running it, and they're working very hard, I will tell you, and we're in very constant communication. If we were doing a bad job, we should also be criticized. But we have done an incredible job. We're going to continue. It's going to disappear. One day it could get worse before it gets better. It could maybe go away. We'll see what happens. Nobody really knows.
The Washington Post's Philip Rucker, who joins us in a moment, is reporting on the challenges this potential health emergency poses for this president and his administration. Quote, Trump finds himself grappling with a crisis for which his record suggests he is particularly ill-suited to respond. At a time when expertise is paramount, Trump has hollowed out the government agencies responsible for the tasks at hand. The Post also broke the story, now confirmed by several outlets, of a new whistleblower complaint. According to reports, the Department of Health and Human Services sent more than a dozen workers to greet Americans evacuated from the center of the outbreak in China, and that they were there without proper training or infection control protection. The federal employees were, quote, sent to March Air Force Base in Riverside County, California, and Travis Air Force Base in Solano County, California. It is reported the aforementioned California patient who mysteriously contracted the virus is from Solano County. During a hearing on Capitol Hill today, Health Secretary Alex Azar was asked about the whistleblower's allegation.
To your knowledge, were any of the ACF employees exposed to high-risk evacuees from China?
They should never have been without appropriate PPE.
What's PPE?
That's personal protective equipment.
Are you aware? It is my understanding that, there was a team, as you just confirmed, that was sent to the March and Travis Air Force bases, and there was it was kind of chaotic on the ground. To your knowledge, were protocols followed at all times?
I would not accept your proposition that chaotic at all times. And I would want to get a report from my team. I'm not aware of any violation of quarantine or isolation protocols.
Back at HHS headquarters today, Vice President Pence headed up his first coronavirus task force meeting. And shortly before that session, the New York Times reported that senior administration officials will now have to check with Pence before they can make public statements about the epidemic. Pence has also named AIDS HIV expert Ambassador Debbie Birx, who's also a physician, to the White House's coronavirus response coordinator. She joins the vice president and health secretary Azar on the front lines of the administration's response to the virus. Today, lawmakers seemed a bit confused over exactly who is now calling the shots.
With the leadership going forward, in Vice President Pence, what's the interface going to be with yourself, Mr. Secretary, between the two of you? Who's going to do what, and how do you see that working in terms of the task force?
Yep. So it'll be a lot of continuity with what we've already been doing. I will remain the chairman of the task force, the interagency task force.
And then we heard this from the vice president.
I'm leading the task force. We'll continue to rely on the secretary's role as chairman of the task force and the leader of Health and Human Services. But we've known each other for many years and worked together very closely over the years, and the president has every confidence in the secretary, as I do.
You may ask about the coronavirus, which is very well under control in our country. The people are getting better. They're all getting better.
We have contained this. I won't say airtight, but pretty close to airtight. We've done a good job in the United States. Hats off to our public health people.
Well, the markets didn't like that at all. The president and his chief economic advisor trying to project a rosy scenario. At the same time, the professionals, the health experts, the scientists at the CDC were saying that it was not a question of if the epidemic gets to the U.S., but when, and that Americans should be prepared for disruption in their daily lives. More than 81,000 cases, 2,700 deaths so far worldwide. At the time we got on the air, it may more being reported every day. NBC's chief foreign correspondent Richard Engel is in Singapore, where nearly 100 cases have been reported, but more than half of those patients have recovered. Phil Rucker is the White House bureau chief for The Washington Post. He is co-author of the book, A Very Stable Genius. Also with us, Dr. Zeke Emanuel, special advisor to the director, the general of the World Health Organization, and a former senior advisor to the Obama White House on health policy, now chairing medical ethics and health policy at the University of Pennsylvania. Welcome all. Richard, first to you there. Ground zero, really. Singapore, of course, and China and the other Asian countries where it all started. Now in Singapore, what are you hearing? How is it spreading?
So we came here because there is a lab where they're working very closely to try and isolate this virus, to figure out its weaknesses. I went to a lab earlier today and spoke with one of the top virologists in the world. And that in this laboratory, they are keeping the most pure strain of the coronavirus, and they have they have it, and they are trying to break down its genetic code to see what works to kill it. And they have some promising leads, but nothing yet. And the virologist told me that it is, in her opinion, going to become a pandemic. You cannot bluff your way through this. You can't market your way through this. You can't just tell people everything is going to be all right when the people who are working very directly with this virus say that it is a matter of time before it spreads. What she told me, what was most unique about this virus, and she's worked on viruses for the past 20 years in frontline experiences, is that it is so contagious. It is not the end of days virus. It is not going to kill us all. 98% of people get better. 98% of them often have mild symptoms, but that is still 2% roughly that die when they get this, and generally it is the elderly or people who are infirm because they have pre-existing medical conditions. And that, if you spread it out over the entire possible infected population, could be a very large number of casualties. She thinks this is going to become a pandemic. We also talked about where it came from, and that is important. That is important in this information age, because if you look online, there are a lot of rumors. Especially now, there are a lot of people going to Google trying to figure out where this came from. And one of the big conspiracy theories out there was that this was some secretive Chinese weapon or a biological weapon that was put out there or escaped. She actually worked in the facility in Wuhan that is often pointed to as a potential culprit for a place where this virus was allegedly being made. She says that is absolutely not the case. She is very convinced, about 90% sure, that it came from bats, and that it was from bat to human in a illegal wildlife market in Wuhan, China. So let's just hear a little bit of what she had to say. We actually went into a cage and saw some of the bats that they are working on and conducting research to try and figure out how the transmission happened and what can be done to find the vulnerabilities in this coronavirus.
So you don't think this was some biological weapon, some plot?
I do not. I don't think it was either intentional or accidental release. This virus came from the wildlife.
Came from bats?
Most likely came from bats, yes.
And came from bats in this wildlife market?
Yes.
And that was pretty extraordinary. With your reporting now, Dr. Emanuel, what have we learned about the mortality? The mortality rate that I had heard from the World Health Organization was generally about 2.5% to 3%. This is not Ebola. But the transmission is also different. Why don't you with your expertise, tell us, having experienced Andrea, the other kind of disease?
You're 100% correct. this isn't at the extreme, either SARS, where we had about a 10% mortality, or Ebola, where you have a much higher mortality, can be as high as 50, 60%. This is closer to seasonal flu. Given the world statistics now, it's somewhere between 2.5% and 3%. But remember, those world statistics of 81,000 cases probably ignore many more cases that are so mild, people think they have a cold or a cough, but don't think that they have coronavirus. So even if you, say, dilute that number by 5-fold or 10-fold, you're down to about 0.5% mortality rate, which is higher than seasonal flu, which is usually around 0.1%. That's 1 out of every 1,000 people who get it will die from it. So it's very different. On the other hand, it's very transmissible, and that's what we're seeing when we've got these hotspots popping up in Iran, in Italy, and in other places where no one has been to China, but now you're getting transmission person to person, and that seems to be very easy. One person transmits it to about 2.5 to 3 people, and then they transmit it. And that's actually the serious problem is, as your correspondent mentioned, widespread transmission with a low death rate is still a high number. And I do think we all in America need to be well aware. We still have a very low number of cases. There are no cases, for example, I'm in Philadelphia, no cases in Pennsylvania. This is going to get worse before it gets better. And I think we need to be prepared for that. And it's been quite clear that the White House has been very slow in preparing or even recognizing this as a problem. I somehow think that maybe they thought closing the border to people from China would do it. At best, it's delayed the entry into the United States. It's certainly not going to prevent it.